I'm getting agreement from the patient,
Yeah.
this is going to make my life and the patient's life easier.
Easier. In
Right.
the initial exam.
Right. With Yeoman, right?
Yeah.
Patients are going to be a little bit. It's going to be difficult for them to identify pain with Yeoman
Okay.
exam.
Okay.
Right. So I'm doing it objectively. If it's tighter on the right
I
side
see,
versus
I see.
the left side, because if I ask the patient, is there any pain? They're thinking about it. They don't know. Sometimes they're confused. Sometimes they're like, yes, there is pain, but at the same time,
Yeah.
the pain is in the front, not in the low back, so it's not positive.
Right.
So I want to make sure that
Sure.
I'm assessing this, objectively.
Mm-hmm.
This is tighter than this side,
Gotcha.
right?
Yep.
The neuro exam should take about 60 seconds.
Okay.
It shouldn't take longer,
Mm-hmm.
right?
I agree.
So I'm not going through pretty much,
Yeah.
a full assessment unless something is not right.
Right.
So if I'm
Then you
going
wanna go deeper. Yeah.
right, so if I'm doing just gross, hey, you feel this the same? Why should I change it or get a pinwheel?
Uh huh.
You're feeling it,
Right. Yeah. You don't have to.
right?
Mm-hmm.
If I'm gonna ask the patient every single time, all the time, for one question: are you getting numbness and tingling? Yes. Okay, let's check it out.
Where is it?
Right? Let's get a pinwheel out.
Yeah.
Let's see the 2-point touch. Let's do a nerve conduction study.
Yeah.
Let's do an ultrasound exam.
Yeah.
So we dive into it a little bit more.
Oh, okay.
But
Then you will move on.
right.
Okay. Okay.
If the patient said, "Oh, no numbness and tingling, life is good," why should I bother?
Gotcha. Of course.
Are you getting numbness and tingling?
Yes. I mean,
Right. If you get numbness and tingling, let's check it out. If you're not getting numbness and tingling, why should I do it? Right?
yeah. We don't want to waste our time.
I don't want to waste that time.
Yeah.
Right?
Patient's time too.
Right. It's
Yeah.
the patient's time, your time.
Yeah.
You want the patient's experience to be very precise.
Mhm.
If the patient doesn't have numbness and tingling, and you're checking them out with a wheel with a pen, the patient is wondering, why are they doing this?
Right.
Right?
Yep.
Like, is there a need for this?
No.
No. Right? If the patient has low back pain, right, and all of a sudden you're doing maximum cervical compression, right? What is this telling the patient? You don't know where you're checking. Right?
Right.
But if you're precise about the area that the patient is hurting, right? So patient has left hip problem, right? Let's say right hip, so we can be able to check it on this side. Patient has right hip problem, and he's checking out their knee. They're wondering, why are they touching my knee, right? The patient has right hip problem. What am I gonna do? I'm gonna go for the right hip,
Right.
right? There was this thief in back in like early 19th century. Can't remember the name right now. And they would ask him, "Hey, why do you keep going to the banks and steal money?" That's where the money is,
That's right.
right? Just go where the money is.
Right.
The patient has pain in the right hip. That's where I'm gonna go.
Right.
Right?
It is true.
Right.
Yeah.
So, like if you're telling me right now I have neck pain, why would I have you do tandem walks?
Right.
If you're telling me I have balance issues, I'm gonna get you to actually do tandem walks. I'm not gonna check your neck.
Mm-hmm.
Right? So it just, the exam has to be like very precise.
Yeah.
The consult is gonna take a little bit longer.
Right.
Because I'm trying to figure out whether this is gonna work out or not. It's like a first date,
Mm-hmm.
right? It's a blind date. So it's a
Yeah.
blind first date.
Yeah.
Right?
Yeah.
The most that anybody's actually known about you
Mhm.
is either from somebody who said something to them about you,
Yeah.
or checked you out on the web. Right?
That's right.
So it's either, it's a setup from a friend who's going to be setting you up to actually have a date with this person, or
Yeah.
it's Tinder. Right?
Yep.
And they're like, hey, I checked out this person's profile. Let me see if this is going to work out.
Right.
So it's the same exact premises.
Mm-hmm.
Right?
Yeah.
So you want to make it as a great of an experience as possible, because
Yeah.
it's either this is going to work out,
Yeah.
or it's going to be just the first date and have a
But
nice
they-
life
right.
and move on. Right?
They will do that, like if they don't, find a connection
Right.
and they see you as a doctor, me a doctor, then they're like, okay,
Then that's it.
yeah,
It's
just the
done.
first day and you're done, and then,
Right.
come back.
Right.
That's
And that's the consult.
yeah.
Right? Good.
The first day is very important.
Right.
I mean.